While India witnessed mock drills across a number of health facilities to assess their readiness and in case the country sees a surge in cases. Union Health Minister Mansukh Mandaviya visited New Delhi Safdarjung Hospital yesterday to review the preparedness. Ascertain the availability of facilities such as beds, adequate oxygen supply and trained manpower across the country. On the other hand, with the genome sequencing taking the forefront with the new SARS-CoV-2 variant, Times Now also visited a genome sequencing lab in Maharashtra's Pune. Here is a report.
देश में कोविड की महामारी न फैले या तो कोविड के केस बढ़े, उसके लिए प्रधानमंत्री जी ने निर्देश दिया है कि हमें सतर्क रहना है, तैयारी करनी है। उसको देखते हुए लगातार भारत सरकार की ओर से कोविड आने वाले दिनों में देश में न फैले उसके लिए तैयारी की जा रही है।
Now, while Times Now also brings you his ground report from Pune, have a look.
COVID outbreak has been recorded in certain parts of the country, maybe China, USA, Japan, Korea, Brazil or other countries wherein the sub-variant of Omicron, that is BF7, is prominently being seen. Now, amidst this situation, all the countries are on high alert. Even the Indian government is seen holding various meetings across the health departments of states as well as at the national level. Certain guidelines have been put out for the COVID appropriate behavior. Vaccination will be revived once again. Masks are not yet compulsory. There is no talk about lockdown because just 4 cases of BF7 are found in India, but all the health department officials, authorities are set on high alert. Now, right now we're standing in the Pune Municipal Corporation, and if we talk specifically about Pune, thermal screening at airports have been started. At International Airport, randomly 2% of the passengers will be tracked, will be tested, and the samples will be sent to various testing facilities. Now, we are going to know about how the genome sequencing is being done, how the samples are collected, stored at -80 degree, then the RNA is differentiated because it's a RNA based virus, so the process is long, and then it is being tested on the sequencers. Now we are going to see how this facility runs and how the entire genome sequencing is being done. If we talk about Pune, all the medical facilities are on alert. The hospitals dedicated to COVID will be revamped and vaccination will be focused on. We are going to know about how the genome sequencing is done and how the state nodal officer is telling us about how will it be conducted for the state of Maharashtra.
Now, the healthcare officials in the Union Territory of Kashmir have also conducted mock drills, assessing all the essential requirements in case of an eventuality. And the Times Now visited one such oxygen facility in Srinagar. We'll bring you this report.
Right now, we're inside this oxygen room which was constructed during COVID emergency. And this has been restarted because during the mock drill, government will assess if there is any faulty equipment. Just in case we will see a rise in COVID cases, they are able to tackle it as soon as possible. Employees of health services are since the morning, you can see, checking equipment, making sure none of the machinery is faulty or there is any difficulty in providing oxygen to people. This is part of a drill that is happening. They're checking if the oxygen flow is perfect and if everything is going well, because the government aims through these drills to make sure that there is no laxity in terms of equipment and other resources as well. They're able to bridge that gap. We saw during COVID first wave how India battled through COVID, and to make sure that if there is any slight rise in COVID cases, they're able to have an upper hand and make sure that the lives are saved. And this is the main hospital in Srinagar city which caters to several patients every day, and there also the government is ensuring that they are able to provide full support to patients.
माशाल्लाह यहाँ फुली प्रिपेयर्ड हैं, हर वक्त हम तैयार रहते हैं। हमारे प्लांट जो हैं वो राउंड द क्लॉक चलते हैं, जिसकी वजह से हमें ऑक्सीजन की कोई शॉर्टेज नहीं है।
Well, that was a report from Srinagar, which we brought to you exclusively as far as the COVID-19 preparedness is concerned, wherein mock drills were conducted in Jammu and Kashmir as well. But apart from this, India's indigenous nasal vaccine is also going to hit the market soon, wherein manufacturer Bharat Biotech has announced a price of rupees 800 for private sale and of rupees 325 for government facilities. The vaccine will also be available in India's COVIN application. Now, as far as this vaccine is concerned, it is a recombinant replication deficient vaccine with a prefusion stabilized SARS-CoV-2 spike protein. The vaccine has successfully completed its third phase of clinical trials as well.